Hey everyone, my name is Dr. Galatea Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an online NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about lower motor neuron lesions. These are the signs and symptoms of a lower motor neuron lesion. But before we begin, we need to know what part of the body we're actually talking about. There are two types of lesions, an upper motor neuron and a lower motor neuron lesion. Both are lesions, meaning that there is damage to that particular area. Upper motor neuron lesions are lesions that occur in either the brain or the spinal cord, so the central nervous system. Lower motor neuron lesions occur in peripheral nerves, so think about cranial nerves. Think about nerves that run to our biceps, quadriceps, skeletal muscles. Keep in mind that we are talking about the somatic nervous system, so it's only occurring in skeletal muscles, not the autonomic nervous system, meaning our organs. A lower motor neuron lesion occurs here. The lesion or damage can occur anywhere along that nerve, starting from the cell body, going through the axon, all the way until the nerve reaches the skeletal muscle. Literally anywhere along here. Just the nerve, though. The lesion cannot occur on the spinal cord. It cannot occur on the muscle itself. These would not be considered a lower motor neuron lesion. Let's get a bit more into the physiology. The left image is the same thing that's going on the right image, but we're just zooming into the spinal cord. Here we have a cross-section of the spinal cord. So we see a top-down view of the spinal cord. We have the peripheral nerve or lower motor neuron starting from the cell body at the anterior horn of the gray matter within the spinal cord, then making its way to the target skeletal muscle, which in this case is the forearm as depicted in the image. Once again, anywhere along the blue dotted lines or the lower motor neuron starting from the cell body can have a lesion and present with lower motor neuron lesion signs and symptoms. The lower motor neuron pathway is actually really straightforward. It just sends information from the cell body to the skeletal muscle. I mean, that's it. That being said, if there is damage to a lower motor neuron, aka a lower motor neuron lesion, in which the job of the nerve, if it's functioning, is to communicate to the muscles to contract, if this communication is lost because it's damaged, your muscle cannot contract. This image. Before continuing, I want to clarify something. Whenever you think of an upper motor neuron or a upper motor neuron lesion, a picture like this, or at least something probably similar, probably pops into your head. There's obviously a lot of stuff going on here, but we're going to keep it simple. What you need to understand is that with a lower motor neuron lesion, this picture actually doesn't really matter too much. It's a picture of spasticity. It explains it really well. If you want more information about spasticity, which is related to an upper motor neuron lesion, I have another video about the muscle spindle apparatus. But what I want you to consider is that with the lower motor neuron lesion, with respect to this picture, this is the part that's affected, the motor part, information to the muscle to tell it to contract. So it's just that green part, the alpha motor neuron. On the other hand, this part doesn't matter. So this is suggesting sensation. Keeping it simple, we're really not even going to talk about sensation because it actually does not matter in the case of a lower motor neuron lesion. I can have sensation. I can have sensation that I just stubbed my toe or I just stepped on a Lego or someone just jerked my arm. However, it doesn't matter what sensation I get because I can receive all of that information to my brain. But in a case of a lower motor neuron lesion, because there's no communication going to my muscle to tell it to react to the sensation, there just won't be any physical reaction because it can't. So it doesn't matter if I have sensation at all or not. So let's go through the effects and see how the signs and symptoms make sense. The first one, the effect on motor function. Well, if the job of the nerve is to tell a muscle to contract, but now the nerve is damaged so it cannot tell a muscle to contract, then it's going to result in no muscle contraction. Well, if there's no muscle contraction, does that mean the muscle is flaccid? I would say yes, and that's why flaccid paralysis is an effect of a lower motor neuron lesion. Reflexes. Let's say you're testing the reflex of someone's bicep tendon. The afferent information from that reflex is going to be felt because there's nothing impaired about that part of the pathway. Sensation is fine. What we would normally expect would be a motor reflex of the biceps muscle contracting as a response to a high velocity tendon stretch from someone hitting a hammer with it, right? That is a reflex. But because that lower motor neuron is damaged, there's a lesion to it, that information to tell the muscle to contract is not sent. So no muscle contraction equals no evidence of a reflex. Now on the chart, you'll notice that it also has an option of decreased reflexes. There are different grades of lesions. There could be a complete lesion. There's absolutely no communication. Or there could be a partial lesion where there is still information being sent. However, because there is a lesion, that communication is not as strong as it would be if there was not a lesion. So that's why you could see a decreased reflex in the case of a partial lesion compared to absolutely no communication, meaning having no reflex at all or absent reflex. So regardless of how severe that lesion is, your reflex will not be normal if you have a lower motor neuron lesion. Going off that topic, the Babinski sign, it's a reflex and an abnormal one at it. I just told you there really aren't reflexes that occur following a lower motor neuron lesion. So that's it. That's why it's absent. Muscle atrophy. Well, if my muscles cannot contract because there is no communication to the muscle to contract, my muscle obviously is going to atrophy. You don't use it, you lose it. Unfortunately, in this case, it's not that you or the patient is not choosing to use your muscles. Your nerves are just not telling your muscles to contract. So if I don't use my muscle because I can't, I'm going to lose my muscle mass, hence atrophy. Lastly, muscle fasciculations. A fasciculation is muscle twitching. After any injury, your body wants to heal. That's just what the body does. I mean, at least it's going to try to heal. Whenever a nerve is damaged, it's going to result in sending abnormal electrical signals. It's abnormal because it's not working properly, right? And when there are electrical signals being sent at all through a nerve, it's going to elicit a response to the target organ, which happens to be the skeletal muscle in this case. So my skeletal muscle is going to randomly twitch as a response because my nerves are being stimulated. I mean, that's all it is. Electrical signals tell my muscle to contract. Again, how much fasciculation occurs, that's going to depend on the severity of the lesion. Let's summarize a little bit. A lower motor neuron lesion. After any damage, your body wants to heal because that's what it does. There are going to be moments of muscle twitching because of abnormal electrical signals. However, overall, just having muscle twitches is not going to be enough to maintain any sort of muscle tone. They're just sporadic twitches. And because of that, as well as the inability to actually use our muscles functionally, because there's pretty much no communication coming from a damaged nerve to that muscle, your muscles are going to get a lot weaker, lose its size, it's going to atrophy. Our muscles are going to be flaccid because they cannot contract. Now, understand, every person is a little bit different, and that's why there are never absolutes, meaning every single person who has a lower motor neuron lesion, 100% of them will have extreme atrophy, and all of them will have a lot of muscle fasciculations. The severity of the lesion matters. The healing capacity of a person matters. Everyone's situation is just going to be a little bit different. But what you see in this chart are just general trends that we see with lower motor neuron lesions. If you feel like you finally understand what a lower motor neuron lesion is, you might actually like the way that SPT with Me teaches. If you're studying for the NPTE, check out our courses at sptwithme.com. Check out these references for more information.